Welcome back, focused learners. Today, we're jumping right into a subject that is literally keeping healthcare executives up at night. We're talking about human capital. Specifically, in this explainer, we're going to take some fairly dense SASB accounting metrics, that's the Sustainability Accounting Standards Board, and transform them into a totally clear, actionable strategy for healthcare delivery retention. Basically, we're unpacking the complex accounting standards so you can see exactly how top-tier facilities measure the absolute lifeblood of their operations, which is, of course, their people.
Seriously, think about that for a second. We measure patient health all day long, right? But how do you measure the health of the actual healthcare workforce? We are living in an era of intense talent shortages, widespread burnout, and just massive competition for skilled practitioners. So tracking workforce metrics, it's definitely not just some bureaucratic HR exercise anymore. It is a vital sign for any facility's operational survival. Let's be real. If you can't measure your talent drain, you absolutely cannot fix it.
Okay, so here's our roadmap for today. First, the healthcare talent crisis. 2, defining our workforce categories. 3, calculating employee turnover rates. 4, documenting practitioner retention efforts. 5, structuring program disclosures. And finally, 6, using data as a strategic advantage.
Section 1. The healthcare talent crisis and why it really matters.
Look, it's no secret. The SASB standard explicitly acknowledges that healthcare delivery entities are facing incredibly fierce competition for physicians and practitioners. Demand is way up, and those shortages are only intensifying. Because of that, your ability to recruit, develop, and retain healthcare practitioners is a fundamental driver of success in this industry. And that brings us right to the specific standard we're unpacking today: employee recruitment, development, and retention. It boils down to 2 main metrics under the code HCDY 330A. The first is quantitative, actually calculating those turnover percentages, and the second is qualitative, describing the real human efforts being made to keep people around. It's a really smart balance of hard numbers and the human narrative.
Section 2. Defining the workforce categories.
Okay, before we can calculate any of those numbers, we really have to know exactly who we're talking about. The SASB framework doesn't just let you lump all your employees together into one giant pool. You have to be precise. To make sure everyone across the industry is comparing apples to apples, SASB relies on the International Labor Organization's ISCO 08 classifications. So you must break your workforce into 3 distinct buckets. Bucket number 1 is physicians. These are your specialists and primary care doctors formerly classified under Minor Group 22.1. Bucket number 2 is non-physician practitioners. This is going to include your PAs, nurse practitioners, nursing and midwifery professionals, and other health pros under Submajor Group 22. And then bucket 3 is all other employees. Basically, this catches everyone else keeping the lights on and the facility running who isn't already classified in those first 2 groups.
Section 3. Calculating employee turnover rates.
Right, so now that we've got our 3 precise buckets, let's get into the cold, hard math of tracking this workforce. For each of those 3 buckets, you actually must track 2 entirely separate types of turnover: voluntary and involuntary. Voluntary turnover is employee-initiated. Think resignations or retirements. Basically, they chose to leave. Involuntary turnover, on the other hand, is entity-initiated. This is when the facility itself makes the choice: dismissals, downsizing, redundancies, or choosing not to renew a contract. If you combine these 2, you get a really messy story. But separating them, that tells a super clear one. A high voluntary turnover rate might signal you've got a toxic culture or non-competitive pay. But high involuntary turnover might point to an organizational restructuring, or maybe just some really poor initial hiring practices.
So the absolutely crucial point here is getting the math right. Thankfully, the formula itself is just simple division. Let's say you're calculating voluntary turnover for physicians. You take the number of those specific separations during your reporting period, and you divide it by the average number of workers employed in that category during that exact same period. And you're going to do this math 6 times total. Why 6? Because you need the voluntary and the involuntary rates for physicians, then for non-physician practitioners, and then for all other employees. Doing it this way yields really clear, comparable percentage rates across the board.
Section 4. Documenting practitioner retention efforts.
Now, knowing your turnover rate, well, that's really just diagnosing the symptom, right? We also need to focus on the cure. So the standard requires organizations to disclose the narrative of how they actually attract and retain this highly sought-after talent. And the guidance here is surprisingly comprehensive about what counts as a retention effort. An organization should be talking about their initiatives across a pretty wide spectrum. Are they offering flexible scheduling? What about leadership development or loan repayment programs, which, are just huge in the medical field? They should be disclosing mental and physical health support systems, mentorship programs, the availability of those highly coveted no-call positions, and even options for part-time employment. Providing this transparent look into these specific offerings shows investors and stakeholders exactly how a facility is actively combating burnout.
Section 5. Structuring program disclosures.
But here's the catch. Simply having a laundry list of nice perks isn't quite enough for a proper sustainability disclosure. The SASB framework actually recommends a very specific structural breakdown for how you talk about these retention programs. You can think of these 4 steps as your mandatory reporting checklist. For any retention program you highlight, let's use a new loan repayment initiative as an example, you should break it down into these 4 phases. 1. The overview. Just what is the program? 2. Implementation. How is it actually rolled out across the organization? 3. Participation. This one is key. How many practitioners are genuinely utilizing it? And 4. Effectiveness. Can you provide the quantitative metrics showing that this program actually works to reduce turnover? This structure right here is what transforms a fluffy HR brochure into hard, actionable operational data.
Section 6. Data as a strategic advantage.
So why go through all this meticulous tracking and reporting? Is it just to keep the regulators happy? No, because this is far more than an accounting exercise. When you rigorously define your workforce, precisely calculate exactly where and how you are losing talent, and transparently measure the effectiveness of your retention programs, you are building a massive competitive advantage. You transition from just desperately reacting to staff shortages to proactively designing an environment where top-tier healthcare professionals actually want to stay. And in healthcare delivery, the stability of your talent directly, unequivocally correlates to the quality of patient care and your financial bottom line.
So I'll leave you with this final thought. Look at the data your organization is collecting right now. Are your turnover metrics just a flashing red warning sign that everyone's ignoring? Or are you actively using them as a roadmap to engineer a stronger, more resilient workforce? Understanding and applying these human capital metrics is the very first step on that roadmap. Thank you so much for joining me for this explainer. Keep learning, and I'll catch you next time.